Despite the surge and promises to speed up testing, long lines continue at many of the lower mainland's COVID-19 testing locations. But so far, health officials don't appear to have done anything about it. CTV's Penny Daflos looks into why more isn't happening right now to make sure British Columbians can get tested quickly.
The lines are long at St. Vincent's Centre in Vancouver, and on Tuesday, Ryan thought it'd be faster than other testing sites. He was wrong.
It took 2.5 hours in line, stopping and going to make it all the way to get tested.
Friday at downtown Vancouver's walk-in testing site, Bella tried to beat the crowds before it opened.
Started waiting 7:45 and it's now 10:16.
The young adult was doing exactly what our top doctor instructed.
I'm pretty much symptom-free, minus just like a sore throat, but I was just in contact with my partner's grandparents and a newborn baby.
Hours in line is still an improvement from March when many were turned away altogether.
Said unless you're sick enough to be hospitalized, they're not doing the testing.
Health officials said they would do more.
Doubling and doubling and doubling, and that will continue.
The week the health minister made that promise, tests peaked around 3,400 on a single day. Since then, more testing, but a new daily record around just 3,600. Compare that to infections, which are spiking again as testing remains basically flat, despite opening up to those with even mild symptoms. It's obvious that with infections on the rise again, more people would need tests. So why hasn't the province ramped up testing in the last 6 months? Fraser Health says we have the ability to increase our testing capacity as required and are actively exploring where the priority areas are. While Vancouver Coastal Health recognizes there is an increased demand for testing and we're working to expand our resources to better meet the demand. They refused to give a timeline, while our top doctor insists
our lab capacity now is good, and we are continuing to build out our lab capacity as we go into the fall. And our intent is to be able to have rapid access to laboratory capacity at about 20,000 tests per day.
A goal for fall as infections surge now. Penny Daflos, CTV News, Vancouver.
Despite signs that BC's infection rate is slowing, that rate is still a lot higher than Ontario and Quebec, where tougher restrictions are being implemented.
CTV's Penny Daflos looks into how BC's response to the pandemic compares to the rest of Canada.
Masks are now mandatory. Certain businesses are closed and we're not supposed to see friends and family, but most businesses are open and the Premier is pleased with that.
We have been successful compared to our neighbors. Example, over the past 7 days, there have been 7,000 more cases of COVID-19 in Alberta than there have been here.
That's true according to federal data, but what the Premier didn't mention is BC has roughly double the active cases of Ontario per capita and even more than Quebec.
But if you ask sort of the average man or woman on the street, they really have no idea about that. And what that causes is a sort of lack of awareness of how serious our situation is.
In Quebec, officials are signaling the gravity of their situation with a new lockdown from Christmas Day till at least January 11th.
Big stores won't be allowed to sell non-essential products.
And while Manitoba's Premier made international headlines for being the face of restrictions,
I'm the guy who's stealing Christmas.
And Ontario's Premier is making a personal pledge.
Every single day you're going to see me out there.
Premier Horgan insists that he's staying out of what he calls the limelight so that public health officials can take the lead. But in the face of infection rates that continue to stay stubbornly high, messaging experts say the urgency isn't being adequately conveyed.
It's a real problem where the situation has kind of become normalized. We're getting used to it. And I think people need to be reframed back into the moment of how serious and how costly making bad decisions can be.
The Premier insists long-term care infections are driving BC's numbers and that every jurisdiction is seeing more cases in the second wave.
We've flattened out comfortably in terms of the raw numbers, but the raw numbers are just too high. But they've stayed relatively flat.
Penny Daflos, CTV News, Vancouver.
You've also been digging into some of the numbers around variants in our communities.
A month ago, Dr. Bonnie Henry said they had screened every COVID case in a specific week to see if there were any undetected variants floating around in the community. At the time, she said it was only 3 cases. Turns out it was 10 times that.
And there was about 30, so about 1% were positive for the screening test, and that was some of the data that I reported at the modeling. And then there were 3 of those that had been done at the time that I reported it. So it was slightly higher.
So it doesn't sound like much, but 0.1% to 1% is actually a really big difference. Add to that the fact that they quietly changed the information in a slide during last week's modeling presentation without acknowledging it. And you've got some researchers saying it speaks to a much bigger problem around both transparency and ongoing data problems we've seen many times now over the course of the pandemic. I've been asking the BC CDC to explain how there could be a tenfold change. I've been asking since Friday. They initially said they replied but haven't provided any information. Henry says variants now account for 10% of cases in BC, with 163 identified over the weekend, Mija.
Penny, thanks for staying on top of this story.
It's not just seniors who are getting vaccinated this week. The province is targeting some high-risk work sites with staff getting the shots. CTV's Penny Daflos has more on who gets to roll up their sleeves now and who think they're waiting too long.
Workers at this Poco Costco were vaccinated after what Fraser Health calls a significant COVID cluster, while this Langley Glass company saw staff get their COVID shot after 44 tested positive. But this Surrey greenhouse had only a handful of cases when Fraser Health called.
I kind of got the impression it's because we'd had a few, 5 or 8 employees who had tested positive in the last month and a half, and that was enough for them to be concerned.
230 staff got the Pfizer vaccine, and while they're in one of several categories health officials already prioritized, including food processing and industrial work camps, the question is, why them?
I don't doubt that there is a rationale, but the public deserves to know what it is. And so what is the current criteria being used for targeting different companies and other workplaces for vaccinations and not schools?
CTV News has learned occupations ranging from construction to naturopaths to office workers are being vaccinated, but teachers whose WorkSafe BC COVID claims are second only to hospital and care home workers.
Schools, particularly in the Fraser Health Authority, seeing upwards of 20, 30 exposure notifications without any appropriate response.
We don't work in a clinical environment with barriers and shields. We quite often do have to go hands-on.
The Vancouver Police Union says while they've had only about 40 positive cases in the past year, they've lost more than 1,600 shifts due to both illness and isolation after exposure.
It certainly is having an effect on our organization.
The health minister is defending the choices public health is making.
Yeah, that's because they are more vulnerable, and they've been determined to be more vulnerable to the transmission of COVID-19 because of circumstances in their workplace.
CTV News asked the Ministry of Health for a list of companies whose employees had been offered the vaccine and were told they're working on it. On Thursday, they're expected to announce which jobs are eligible for the incoming AstraZeneca doses. Penny Daflos, CTV News, Vancouver.
CTV News has learned the P1 or Brazilian variant is surging in the Vancouver area. We've gone from a handful of cases to more than 200 in the course of a couple of weeks at a single lab. More now from CTV's Penny Daflos, who broke the story today.
Within the St. Paul's Hospital complex is a massive lab that tests the majority of COVID samples in Vancouver Coastal Health. It's where scientists first discovered an undetected cluster of the P1 variant. On March 10th, there were just 14 cases found in the entire province. 2 weeks later, 176. Now CTV News has learned there are up to 215 cases at the downtown lab alone.
At St. Paul's Hospital, we've actually identified more P1 variants than the entire United States. It is the most concerning. It's the one that scientists are really concerned about.
First discovered in Brazil, scientists say not only is P1 more infectious, it can reinfect those who've recovered from COVID.
It is concerning because this is a variant that we've seen be very destructive in Brazil, and there's concerns about the effectiveness of vaccines.
The provincial health officer has spoken extensively about the B117 variant first discovered in the UK and the most common variant in BC. She didn't bring up P1 until asked yesterday.
Yes, we are watching those very carefully. Most of those are no longer active cases. There was a large cluster in Vancouver Coastal that was contained.
Dr. Henry says that BC is now screening close to 100% of positive samples for variants. In the United States, however, they're screening only a small fraction, with critics questioning whether the U.S. might be flying blind when it comes to variants. In Brazil, hospitals are overwhelmed and thousands more die daily, led by a president rejecting public health advice. As doctors fight a losing battle against variant-fueled COVID. That glimpse into the future is concerning to experts.
We're just at the cusp of seeing an influx of variants. And so it's a critical point in the pandemic, and I think now is not the time to be complacent.
Penny Daflos, CTV News, Vancouver.
We'll get the latest case numbers from health officials tomorrow, but in the meantime, one of BC's advisors on COVID response says variants from the UK and Brazil are now the dominant strains in this province. But public reporting of the variants has been minimal. CTV's Penny Daflos now on the warning and the reality.
We now know COVID-19 is a nasty and erratic virus, killing some while others barely have a sniffle. What's been tightly under wraps in BC is how many of the more contagious variants are circulating here.
I got very disturbed yesterday about the number of variants going down to 90 and the number of active cases going down, and just realizing that that's false. And it gives people the misleading opinion that we're dealing with the same thing we've always been dealing with, and the variants really aren't taking over.
Instead, local scientists believe we've crossed the 50% mark, with variants now more common than traditional COVID, and could be why we're seeing a sudden surge in cases. The sprawling lab complex at St. Paul's Hospital has found more of the P1 variant first found in Brazil than the entire United States.
That is considered by some to be the most concerning of all the three major variants of concern.
Scientists there have developed a shortcut to detecting variants instead of taking days.
The method that we're using is it's PCR-based, it's versatile, and it's rapid.
The province has acknowledged a lag between the time when they identify variants versus reporting them to the public. That's because they want to be able to tell us exactly what kind. But Otto believes that early warnings are actually much more important.
I think the public good would have been better served knowing more about just how many variants were circulating. I do think more people would have been more careful in their traveling, more careful in their contacts with others, if they just knew how high a percentage the variants were.
For example, the same variant ravaging Brazil by reinfecting COVID patients and spreading like wildfire is the same kind that hit Whistler with an infection rate that closed the resort. Outdoor activities hadn't been so much the problem as indoor ones. It was only as spring break was ending that officials revealed how much higher the risk had been. Penny Daflos, CTV News, Vancouver.
Calls are growing tonight for greater transparency from the province. Experts are urging the government to show its cards so more people buy into restrictions, even as they become more pandemic weary. CTV's Penny Daflos has that story.
As the pandemic drags into its 13th month, COVID fatigue is gnawing at even strict rule followers.
You're asking people to do extraordinary things and take guidance on faith without information that really impacts their lives.
And so more people are calling for more information and explanation.
How those decisions are being made, what data is being used, and why something might be working somewhere else, but it's not applicable to BC.
CTV News spoke with a range of experts, all echoing the same sentiment.
Transparency builds trust.
Be transparent with people and treat them like grown-ups.
We can only fight this new variant if the community ramps up their restrictions, and they have to be informed about why.
And it's not a matter of knowing just for the sake of knowing. Municipal governments and leaders in Aboriginal or minority communities, as well as some high-risk occupations, often have little insight and therefore trouble focusing on problem areas.
We have been transparent as any jurisdiction in North America.
Despite that claim, the facts tell a different story. Quebec publishes each hospital's COVID count. Alberta has interactive maps on active cases in each neighborhood and school. In Ontario, each county has a breakdown of active cases, the number of variants, and how many people are vaccinated.
The BC CDC dashboard does have age groups. We get that weekly in a number of different ways. We can, I'm not sure what you want, to be honest.
That's part of the problem. But this palliative care doctor points out knowledge typically eases anxiety.
Having a paternalistic approach of, well, we know best. We know it's not working because look at where we're at right now.
It is very possible more information will likely mean more criticism, but
if we are comfortable in the decisions we're making, then there should be no reason why we wouldn't show our work and show how we reached that decision.
Penny Daflos, CTV News, Vancouver.
COVID outbreaks are still happening in BC care homes despite high vaccination rates for residents. And tonight it's raising questions over how many staff have had their shot. As CTV's Penny Daflos reports, it's something even care home operators don't know.
More than 90% of seniors in long-term care and assisted living have had at least one COVID shot, and yet each week
we have one new outbreak to report,
raising questions about how many caregivers are vaccinated.
Operators of nursing homes don't know how many of their staff have been vaccinated, so you can't really assess risk in the workplace without that knowledge.
I think the overall take-up in long-term care of vaccination has been excellent.
The key question, whether some individual care homes may have exceptionally low staff vaccination rates. Anecdotally, there are reports as few as 1 in 5 have had their shots in some facilities.
Remember, there are new people coming in and working, and obviously new residents.
The Ministry of Health has provided province-wide stats showing that compared to last month, 1,265 more workers have had their first shot, but they haven't outlined what percentage that represents. The lack of details around staff vaccinations come as care home outbreaks come under renewed scrutiny, with a troubling revelation from the province's top doctor.
It has come to my attention in the past week that there are several outbreaks in assisted living that were responded to but have not been reported or posted.
One of them at Vancouver's Terraces on West 7th wasn't considered an outbreak when it happened back in December. Instead, Vancouver Coastal Health classified it under the half step of enhanced surveillance, defined as being a single staff member with COVID. But 10 residents got sick and 2 people died, and only now, 5 months later, has it been listed as an outbreak.
Full action was taken by local public health and by my public health colleagues to manage with those facilities.
The Canadian Medical Association Journal is urging mandatory vaccinations for healthcare workers, including those in long-term care and assisted living.
Where you've had an outbreak in the past, we see greater uptake, and that's natural. People are far more personally aware of the ramifications, but we don't know that for sure because we just don't have the data.
Penny Daflos, CTV News, Vancouver.
New research from the Royal Society of Canada is raising serious questions about how many people have actually died from COVID-19.
BC's top doctor is on the defensive, but even the World Health Organization has taken notice of a study estimating the death toll could actually be double what the government has reported. Penny Daflos explains.
It is a well-known fact COVID-19 ravaged the frail and elderly population in BC care homes. But researchers say officials have undercounted COVID-19 deaths in the community.
A lot more people died than we thought.
Overall, more people died than expected in 2020 in this country. A new Royal Society of Canada paper suggests more than 1,700 British Columbians died from COVID from last February to November, twice the official total.
BC's specific cause of death reporting is so slow and so bad that if there's a competing explanation, we wouldn't know because we don't have the information.
I don't agree with what that report has come out with.
The provincial health officer acknowledges they likely missed a few cases early on, but has her own theory about the excess deaths.
So not directly related to COVID, but more related to people who didn't access hospital services when they needed to.
Dr. Henry may be dismissive of the report, but hours after our CTV story went online, a WHO advisor reached out to point out the World Health Organization also believes COVID deaths have been significantly undercounted. Low testing, atypical symptoms in seniors, and prevalence in low-income and racialized communities are cited as factors by the Canadian researchers.
I don't think the way we have responded to COVID has been equitable in any way.
Many scientists are not surprised by the findings and are urging the province to fix its data reporting process, which is among the slowest in the country and impacts responses to other diseases and epidemics.
We need to go beyond COVID. We have another public health emergency in town. We've been dealing with it for 5 years, and we haven't done a better job. I think there are structural issues here that need to be identified with reports like this.
While final numbers won't be official for at least a year, Moriarty hopes the research will prompt discussion and change.
It's really distressing how that could have happened. How so many people dying could have gone unnoticed is really disturbing.
Penny Daflos, CTV News, Vancouver.